Mesothelioma is a form of cancer that affects the mesothelium. The mesothelium is a membrane that covers many of the body's internal organs, such as the lungs and heart, and also lines the chest, the abdomen, and the area around the heart. The mesothelium is composed of mesothelial cells. When these cells become cancerous, mesothelioma develops. There are several types of mesothelioma. Pleural mesothelioma, which affects the chest wall lining and the lungs. Peritoneal mesothelioma, which affects the abdomen. Pericardial mesothelioma, which affects the sac surrounding the heart. And most rarely, tunica vaginalis mesothelioma, which affects the layer of tissue surrounding the testes in males. By far, the most common form of mesothelioma is pleural mesothelioma, which accounts for up to 75% of all cases of the disease. The most common cause of pleural mesothelioma is exposure to asbestos, a term which describes a group of 6 naturally occurring minerals. From the late 1800s through the late 20th century, asbestos was widely used in industrial and construction processes, as well as in the production of many household products. Known for its cloth-like qualities, its strength, and its resistance to heat and fire, asbestos offered many obvious advantages in production processes. However, it also posed great risk to those who came into contact with it, a fact which was discovered and documented by the 1920s. For decades, industries and employers ranging from steel and shipbuilding companies to the U.S. Navy knew about the risk of asbestos exposure, but withheld this information from workers and failed to provide adequate safety equipment. It was not until 1989, however, that the Environmental Protection Agency banned most uses of asbestos in the United States. Limited, regulated use continues today in the United States. Asbestos exposure occurs when its fibers become airborne and are either inhaled or swallowed. Fibers become lodged in tissue, particularly in the lungs or chest wall. Over the years, these fibers act as aggravating agents and can ultimately lead to the development of mesothelioma. This explains how pleural mesothelioma begins. Once exposure occurs, an individual will always be at risk. It may take anywhere from 15 to 50 years for the disease to develop after an initial exposure. Early symptoms of pleural mesothelioma may at first seem like those associated with common ailments, and for this reason, it often takes up to 3 months after the onset of symptoms for an individual to seek medical care. Lower back pain and/or discomfort in the side of the chest are very common early symptoms of pleural mesothelioma. Some people may experience cough, sweating, fever, exhaustion, weight loss, and difficulty swallowing. People may also cough up blood and experience swelling of the face and arms, hoarseness, and weakness. Pleural mesothelioma can be diagnosed through a physical exam, diagnostic imaging, and tissue and fluid samples. Pleural mesothelioma can affect the lining of the chest wall or of the lungs. As it advances, it can spread to lymph nodes, from one side of the chest wall lining to the other, and to other parts of the body. The spread of the disease is called metastasis. Once an initial diagnosis is made, a process called staging is used to describe the size, location, and extent of the primary tumor. As the disease progresses, staging is used to track changes. There are 3 primary established staging systems. These are the Bouchard system. It's based on the primary tumor size. The TNM system refers to the size of the primary tumor, whether or not the cancer has spread to nearby nodes, and whether it has metastasized distantly. And the Brigham system stages the cancer based on whether the tumor can be removed by surgery or resected, and whether or not lymph nodes are affected. The next step is for a patient and his or her physician to determine the best course of treatment for him or her. This decision should be based on the patient's wishes, the stage of the disease, and factors such as the patient's general health, age, weight, and gender. The most common and established forms of treatment for pleural mesothelioma are surgery, chemotherapy, and radiation. Examples of these types of treatments are described here. There are two surgical approaches to respond to mesothelioma. Palliative surgery is used to alleviate the discomfort caused by symptoms such as shortness of breath related to fluid in the pleura pushing against the lungs. And curative surgery is used to slow or stop the growth of the disease and to extend a patient's life. To reduce shortness of breath, a doctor can perform a thoracentesis to drain this fluid. In some cases, the doctor will also inject either talc or drugs which create scar tissue into the chest to prevent further fluid from entering the chest cavity. This technique is called pleurodesis and is effective for a time. However, if this procedure is performed frequently, it can actually increase the chance of fluid returning to the chest cavity. However, the risks do not typically outweigh the increased comfort that a pleurodesis provides. Chemotherapy uses drugs that kill cancer cells to treat mesothelioma. It can also be used to destroy cancer that comes back or that has metastasized or spread to other parts of the body. The names of some of the most commonly used drugs are cisplatin, gemcitabine, caramcine, and endostatin. Drugs may be administered individually or in pairs. Radiation therapy is administered to kill cancerous cells. There are a number of ways to administer radiation therapy, either internally or externally. Internal radiation is delivered into the body, and external radiation is provided by a linear accelerator or by a type of machine that has as its radiation source a radioactive substance. However, radiation therapy is not considered the most effective treatment for mesothelioma. Pleural mesothelioma is considered treatable, but generally not curable. Treatment has been shown to reduce the symptoms and discomfort caused by pleural mesothelioma. In some cases, it also extends an individual's lifespan. Thank you for watching. This video was produced by Asbestos.Net, a leading resource on all aspects of asbestos and mesothelioma. Our priority is to inform victims about the devastating effects of asbestos exposure, mesothelioma, asbestos cancer, asbestosis, and other asbestos-related diseases, and to advise them with a wealth of information. Individuals whose lives have been touched by mesothelioma have numerous questions and concerns. Their caregivers and family members also need accurate, reliable information. If you or a loved one have been diagnosed with mesothelioma or asbestos cancer and need more information, we invite you to visit and explore the thousands of pages of oncologist-reviewed material on Asbestos.net, to call our convenient toll-free number shown below and speak with a mesothelioma specialist, or to use the simple contact form found at Asbestos.net to request a free copy of our informative books, custom inserts, and DVD. Asbestos.net. Information and help for patients and families.